Hi, I'm Mackie Shilstone. As someone who was raised here in New Orleans, the state of Louisiana, I learned at a very early age just how much I really enjoyed partaking during the season of crawfish. It's an important industry for our state, especially when you think of a number of people that are involved, and also think about how crawfish are exported all over this country and maybe the world, and they're raised right here in southern Louisiana. Well, having written 6 books on wellness, I want to point out to you just how they can fit into an overall healthy eating plan. Whether you're someone that decides to be on a high protein intake, someone such as that is on a keto friendly diet, or if you're on a Mediterranean eating plan where you want to emphasize seafood and reduce your incidence of eating red meat and emphasize more vegetables, and you'd like to have nuts and seeds and grains, that's the lifestyle to live by. In my books, I talk about that. Well, crawfish can work right into those types of healthy eating plans. First of all, in 5/8 of a cup, that's 75 calories. You're getting 16 grams of protein, and that can compete very highly with 1 cup of yogurt. In fact, that's typically 11 grams, where you're getting 16 grams in 5/8 of a cup of cooked crawfish. The other thing is that you're getting almost no fat, very low fat. You're getting almost no saturated fat, no carbohydrates. And when you think about the other benefits, for those of you on a low sodium intake, it's all about how you cook or boil the crawfish. Keep that in mind, or that how you use the crawfish in some of your recipes. So just the 5/8 of a cup of crawfish itself is 170 milligrams of sodium. Those of you on a sodium restricted diet, usually less than 2,200 milligrams. And those of you with high blood pressure that may need to go below 1,500 milligrams a day, 170 calories can fit right into a, so to speak, generalized 2,000 calorie meal plan. Also, one other thing to keep in mind, for those of you trying to look at your cholesterol, you can easily think how shellfish can be a source of cholesterol. Well, of course, they are. But 5/8 of a cup of crawfish is 126 milligrams, which is well below the threshold of 300 milligrams in a day set by the American Heart Association and the National Institute of Health. Now, on a performance side, I told you about that protein. Well, what about you think about that magnesium in there? Magnesium is very important for muscle recovery, but it's also effective at helping you to reduce your risk or reduce the risk with those people that do have an elevated systolic blood pressure and diastolic. More importantly, I would say the diastolic. That's the lower number. Magnesium has more of an impact on that. Something to talk to your doctor about in general on magnesium. And then the other point I would make would be zinc. We talk about coming out of the COVID time periods as we are, and zinc is important for support of the innate and adaptive immune system, but it's also going to help in muscle adaptation to help to keep the muscles strong. So all in all, crawfish, well, in season, that's the thing to look at. It all has to do with how you prepare them. If you want low sodium, just reduce the amount of sodium that you use in the cooking or use sodium alternatives. Also, when you boil your crawfish and you're on that low sodium the mix in, why don't you think about putting Brussels sprouts, broccoli, carrots, potatoes, so you get your vegetables right in there with your protein. That's the way to go. Put it on your salad and you have one healthy plan of attack.